health is an issue that we can't solve in a day, just in a day or overnight. That is why all these initiatives are coming up together so that we can come up with at least a long-term solution to these issues. We have witnessed our students committing suicide, and that is not just a matter that we should joke around with. I'm sorry, the CEO mega motive is, you have listed out the issues that are affecting the comrades, and one of them is relationships. We have academic pressure, and the key one is, I think, finances. But the school is kind of trying to assist these students, because when we have, let me say, the issue about finances, academic pressure, let me say school fees, we have the bursaries, and I believe you have seen the memos going around. We have the Ratansi bursary, we have the Somu bursary, we also have the work study, whereby, let me not say needy students, but students who are not able to raise their fees wanaweza usaidizi from the school. But that is not just enough. See, you have heard of cases of people getting 2,000, 150. That is not enough. So we are trying to at least create these networks that will help our students, let me say, raise their school fees. And an issue relating to mental health and drug and substance abuse awareness, as Julius has said, next week, that is from Monday, we'll be having an awareness campaign week, whereby we expect all of us to come up together as comrades and walk to those hostels. So these people in Yanajita introverts are the ones who they affected the most. They are not ready to speak up. So in a way, if we try to reach out to them, at least it will be somehow effective. Because hostel, they don't have somebody to talk to. They're not even aware of, we have the guiding and counseling services. So if we do the door-to-door services, at least we'll be helping a lot of them. We also have initiatives that their main role, or maybe that they are in line with mental health campaign and drug and substance abuse campaign. Let me say, when you're going to talk to a student mwenye amelala njaa for 2 days, you won't just go and tell them, oh, sijali, utapata. See, at least you have to show actions. You use this for the time being, tukitafuta ingine, si ndio? So I've tried to figure out the kind of challenges that as initiatives we go through, and one of them is lack of funding. Si ndio? All of us, we are willing to at least help these students, but then if we lack these finances, because utaenda kuambia mtu, let me say a girl mwenye hana pads, ati usijali utapata tu. At least you have to show action, you go with those pads. So as Angeli Beatrice, I cannot fund these initiatives. Hata mimi saa ingine huwa nainama. But what I can do is I can just give you the platforms for you to look for assistance from what we at least they're above us. We also have many peers. There is the guiding and counseling peers up at yeah. So peer counselors. So most of us are really willing to help our comrades, but in a way we lack the, let me say, the knowledge or the mentorship on how we are going to approach these cases. The way you are going to approach a student mwenye is lacking school fees is not the same way you are going to approach a student who is addicted to drugs. So we all need these mentorship programs for us at least to be supportive to our students. And also thank our peers, because she said that when she comes to Maseno and then you raise those issues to her, at least she'll offer this mentorship program to our peers. See, at least you clap for her. That is good.
If you're going to do anything sustainable about our lives, you must refuse to sit on the sidelines. You must get into the discussions. And I'm going to tell you this, no one will invite you. I've had a discussion with the counseling department. I've had a discussion with the career department, and I think they're going to be part of this movement. And I know that Madam is it VP or VC? VP, Madam VP. In fact, Madam VP is part of us. That we are going to have this. I believe we are going to have a nice discussion. I know that I'm waiting for one of the departments to confirm the date and the venue, but it's a debate called "No Romance Without Finance."
You see that most of comrades, we just want to live beyond our limit. What you can't achieve, you see that each individual why has this particular thing, and you cannot afford it. Yet you want to live at that particular life. These are caused by lack of counseling services. So you coming up with this certain group, I think it will help most of the comrades. And the issue of comrades committing suicide, I think it will reach a certain limit.
Ladies have been facing the stigmatization from men who feel like when you are on your on your menstrual period days, you don't fit to stand before people. So our counseling department 28th going on, you can just tell us, oh, my day is 28, so that when today I call and say you call a friend and I'm not fine, and I look it's 28, I know, yeah, maybe this may be the reason, so that we help each other. Let us not stigmatize. So that stigmatization is what has been bringing out the mental problem. The stigmatization from our ladies and stigmatization from our men. So both sides, let us help to speak about menstrual period and menstrual health. Menstrual hygiene management is important to all of us.